A final area that we wanted to cover in this presentation is mental health. Like with all other individuals, the development of self-image and self-concept is very important for individuals with OI. Being able to define their strengths and their abilities, as well as any limitations, can assist in the development of the person as a whole and increase their belief in themselves and what they can accomplish in life. Due to the chronic nature of OI, individuals living with this condition are susceptible to experiencing low self-esteem as well as anxiety and/or depression. It is important to seek out proper medical help if an individual believes they're experiencing these feelings. It is also important to understand that individuals with OI are still entirely capable of having loving and close relationships with friends and significant others, as well as cultivating a successful life personally and professionally. There are many different strategies that can be utilized when dealing with any mental health issues. Staying informed on OI can be beneficial if living with this condition because if they become an expert in their own condition and they remain informed, they can maintain knowledge about what they might expect of OI through their own lifespan. It can also be helpful to reach out to other people who are living with OI and possibly use their strategies or techniques for solving various problems that they might come across in their own life. These individuals should also never underestimate the power of a support system, because having a large support system around can also help cope with any OI-related problems and maintain that the individual can always look to someone for help and support if needed. It also reduces the feeling of isolation and makes the individual feel as though they're not dealing with this condition alone. Maintaining education in daily life is also incredibly important. Learning independent living skills and continuing to prepare for a future career are also good measures for an individual with OI to accomplish. Having this condition should not stop the individual from achieving a desired career or maintaining a good education as they grow up. In fact, supporting occupational participation in school activities and the choosing of a desired career will support the individual's future as an adult and set them up for the most success and highest level of independence as an adult. And finally, we're going to talk about sexuality and reproduction. Learning about sexuality is fairly aligned with a typical sex education. Individuals with OI do need to be aware of the genetic likelihood of passing this condition on to their children, but many individuals with OI still successfully have children and start their own families. They can also adopt or do surrogacy. If the mother has OI, then she should consult an expert medical professional to ensure that any OI-related complications like a history of pelvic or spinal fractures or a short stature can be addressed. Typically, bone loss is also experienced during any pregnancy, so this takes longer for a woman with OI to recover from, and that should also be acknowledged by a medical professional and the mother-to-be.